All right, it is noon, so we're going to go ahead and get started. Hi, everyone. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. Thank you for joining us for another segment of Numbers with Nick. So today, we're going to be talking about the case activity that's happening in Rock County most recently, and also talk a little bit about the Delta variant that you may have heard about. If you have any questions, you can feel free to put those in the chat box as we're going through here. And we'll try to answer questions at the end of the stream if there are any questions. Otherwise, you can always reach out to us via social media. So without further ado, let's get into the content for today. So starting out, just looking at the number of new cases that are being reported to the health department at this point, the case activity is very, very low, which is great news. We are seeing about on average 1 to 2 new cases being identified in a given day over the last couple weeks now. So we are in a period of declining COVID activity, and we're seeing the number of total active cases out there continuing to decline. So the graph I have here on the middle of the screen with the red bars and the black line, this is the case activity and the number of new cases that are being reported to the health department on a daily basis. And then the black line shows the 7-day moving average. So we can see kind of what the trends are when we smooth out some of the variation that happens on a day-to-day basis. We did have a small peak in terms of COVID activity that happened kind of at the end of April and early May. And since that time, we're seeing a very steady number of decline in case activity. Right now, like I said, we're seeing very, very low averages of the number of new cases. And we have a pretty good number of people who are vaccinated in Rock County. So the graphic down here at the bottom of the page, this shows the number of people who are vaccinated based on the total number of people in Rock County who are currently eligible. So that's about 137,000 residents at this point. And that's based on those who are 12 and older who can get vaccinated. So we do have a chunk of the population. It's about 26,000 individuals who are under 12. And so, we're above 50% in terms of the eligible population having received the vaccine. But right now, we're just below 50% in terms of our total population having received the at least one dose of the vaccine. And that means that, there's still a large chunk of our population that is susceptible to infection from the virus. And that brings me to the second topic of today's video. I wanted to talk a little bit about the Delta strain that you may have heard about. So this is a newer variant strain that is currently a cause for concern because of how rapidly it circulates. So I'm going to switch gears a little bit. I'm now looking at the state website. Wisconsin has put together some data related to the variants of concern that have been identified in Wisconsin. So this table here in the middle of the screen shows the number of specimens that have been sequenced and identified to be of one of the variants of concern. So as you can see, they've only sequenced about 16,000 of these specimens. So not everyone who is tested for COVID-19 has their specimen submitted to the state lab for sequencing. The resources involved in sequencing and determining what variant a person has can be extensive. And so what happens is they don't always submit every specimen that is collected for sequencing. Only a small number of tests are actually sent to the state lab for sequencing. There's been over 2 million tests of Wisconsin residents. So a very, very small percentage of those tests are actually being sequenced. So this just gives you a sample size of some of the variants that have been identified. All that really means is that these numbers aren't necessarily the full picture of how many of each of these variants that are circulating currently. It's just it's a sample size based on what we have and the information that we have available and how much genetic sequencing has been done. So you can see that we have the names of the variants, including their letters and numbers, and also they've been given these nicknames in terms of alpha, beta, epsilon, delta, and gamma. So the one that we're focused on right now is the Delta variant, and this is the variant that originally came from India. And the reason that we're concerned about this variant in particular is that it seems to be more highly infectious than the other variants. So it's when we compare the Delta variant to the Alpha variant, so far the research has shown that the Delta variant is about 50% more infective than the Alpha variant. And if you remember when the Alpha variant first emerged as kind of the first variant of concern, this one was much more infectious than kind of the previously circulating strains of COVID-19. So now we have another variant that's even more infectious than a previous variant of concern. And that's one of the reasons that I think lead public health kind of agencies and experts across the country are worried about if the Delta variant takes hold in places where there isn't sufficient vaccine coverage. And so right now in Rock County, with just under 50% of our population having gotten at least one dose of the vaccine, that's pretty good when we compare ourselves to other places across the country. There are certain states that only have about 20 to 30% of their population who have been fully vaccinated or gotten one dose of the vaccine. When we compare our rates of vaccination to other counties across Wisconsin, we're probably right below kind of where the average is. So we have a little bit of ground to cover if we want to be up there with the top kind of counties in Wisconsin in terms of their vaccination coverage. And all of this means is that there is a significant chunk of the population that doesn't have protection from this Delta variant. So it has been shown that having completed the full series of the COVID-19 vaccine does provide protection to the individual from contracting the Delta variant. The vaccines are slightly less effective against contracting the Delta variant than some of the other previous strains of COVID-19. So although it is not 100% sure that you'll be protected from the virus if you do get vaccinated, that's going to offer the greatest amount of protection from this variant. So we're really encouraging still that people get vaccinated, that you talk to your healthcare provider if you have questions about getting vaccinated or the vaccine itself. And you check out rockcountyshot.com to see what vaccine providers in your area are offering the vaccine. Many providers offer walk-in appointments. There's no cost to the individual to receive the vaccine, and they have very flexible hours at this point. So again, that website is rockcountyshot.com. The state of Wisconsin does provide us with some more detailed information about where these variants are more or less prevalent. So Rock County is in the south central region. Right now, only 0.2% of the specimens that have been genetically sequenced are coming up with the Delta variant. So that means that there have been identified cases of the Delta variant, but it's not as high, for example, as the percent of specimens that are sequenced in the Northeast region. But what it does mean, although our rates are relatively low right now, it does mean that the Delta variant could easily take hold in terms of causing an uptick in the number of COVID-19 cases that we're seeing, especially among those who are not vaccinated. We have children who are under 12 who aren't able to get the vaccine, and then a number of Rock County residents have not been vaccinated yet. And all of these individuals are at higher risk for contracting COVID-19, and they are at particular risk for contracting the Delta variant of COVID-19, which could lead to much more people becoming ill and also more severe illness and people needing to be hospitalized. The other finding that they're seeing in terms of the infections and people who are infected with the Delta variant is that there is the possibility that the person will respond less favorably to some of the treatments that are available in the health system. So if someone contracts COVID-19 and it happens to be the Delta variant and they are so severely ill that they need to be hospitalized, some of the treatments that have been used and used effectively in the past may not be effective for those individuals. So again, it's very important that we're maintaining our vigilance and driving these numbers into the ground. As we're seeing less and less COVID activity, it would be great if we could see almost no COVID spread through the summer and before the school year starts, so that we're starting the school year off on the right foot and preventing kind of any kind of risk to our children, especially, and seeing cases rise once the kids are back in school. So that's all I wanted to cover for today's video. Just wanted to give some information about the Delta variant and what we're seeing so far. Looks like we do actually have a question. So thanks for popping the question into the comments. So the question is, when you say it still offers protection, can you clarify that it doesn't keep everyone from getting sick, but is highly effective? So yeah, the question is kind of clarification on what that protection means in terms of vaccination. So those who are fully vaccinated and potentially could, the vaccine, like I said, isn't 100% effective from preventing someone from getting COVID-19 and especially the Delta variant. And so in those situations where someone is fully vaccinated and they do contract the Delta variant strain of the COVID-19, they are much more protected and at much lower risk of needing to be hospitalized and becoming severely ill. So even though someone can contract COVID-19 being fully vaccinated, the vaccine does provide protection to that individual. And we've seen in terms of our Rock County data that many people who are hospitalized have no record of being vaccinated. So our most severely ill individuals in Rock County are those who are unvaccinated. People who are vaccinated are avoiding needing to go to the hospital for the severity of their illness. So I hope that answered that question. I'm just going to look to the chat box to see if there are any other questions. It looks like there are no other questions. So with that, we're going to close out the stream today. Thanks everyone for joining today. And as always, if you do have additional questions after the stream is over, you can always reach out to us via social media. And just wish everyone a happy 4th of July and stay safe over this holiday weekend. Thanks everyone. We'll see you in a couple weeks.